Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. Hi, and welcome to this week's episode of the Tongue Tie Experts podcast. I'm your host, Lisa Palladino, and before we get into the show, I wanted to explain a little bit about why it may sound a little different than typical episodes. This is a recording of an Instagram Live that we did in response to a New York Times article regarding tongue tie treatment. The article featured my colleague, Dr. Scott Siegel. Dr. Siegel's practice and the practice of IBCLCs was not fairly represented. In this live, we delve into why Dr. Siegel agreed to open his office to reporters, how he feels about how his practice was portrayed, and what he shared with the reporters that wasn't included in their story. During the episode, I also read my official response to the article. Also during the show, you'll hear me reading live comments and questions for those who were responding while we were on live. It's a bit different than we usually do, and I appreciate your patience with that. Thanks so much for listening and for being a part of the Tongue Tie Experts community. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Palladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Welcome, everyone. Lisa here for a very special Tongue Tie Experts event. For those who don't know me, I typically go live every Tuesday, usually in the afternoon. But this week, it's been a pretty exciting week. So we decided to make this a little bit later, have a special guest. And many of you are joining us for the first time. So many new followers. So many people have been upset or excited or just wondering about
how do I classify it? The article that was, I'll just call it an article in the New York Times about tongue tie treatment. And we're going to talk all about that today. We're going to tell the side of the story that wasn't told. We'll be able to take your questions. And the reason that I'm doing this mainly is because, well, number one, I'm scared, I'm afraid that people will neglect to get the treatment they need based on the one-sided portrayal from this article. And we'll talk more about that as we go on. And also because I have a feeling Dr. Siegel said a lot more. And Melanie, who's also the IBCLC in the article, had a lot more to say. Even Kathy Watson-Jenna, who's, you've seen on my platform before, probably said more than what was included in the article. And it sounds pretty scary for parents and for other providers. So as a responsible person who calls her, my platform Tongue Tie Experts, I felt compelled to speak out on this topic. Dr. Siegel is going to join us in a moment. I just wanted to take a minute and read to you my response to the article that I will be sending to the New York Times, okay? Because it kind of consolidates what I'm thinking. It took me a while to get this written right and not sound angry. And I'd love to know everybody's opinion on it. And if you want to add to it, feel free to. Once again, thank you so much for being here. And this reading of my response will give you a little bit of background of who I am if you haven't already met me. So, as the face behind the popular Tongue Tie Experts social media platform and the Tongue Tie Experts podcast, I feel compelled to respond to the latest article about tongue tie treatment from the New York Times. I am a certified nurse midwife, lactation consultant, registered nurse, and published author who has over 35 years of experience in the healthcare system. I am upset by the tone of this article, but also encouraged by the conversations it is creating. We need to have these important discussions. First, you may wonder why I have a social media presence as a healthcare provider. Why are so many families turning to social media for their medical needs? In my experience, they are looking for help because they aren't getting it from the doctors and nurses who they are seeing in real life. Sad, but true. My social media popularity grew totally accidentally. Trust me, I never intended any of it. It has just evolved. Let's talk about social media advice. It comes in all shapes and sizes. Some of us are experienced. Some are pretenders. Some are pretenders. Some of us give real support and education. Others, well, not so much. The point is that many women want to breastfeed and they aren't finding the right support when things don't go smoothly from their doctors. And my resources fill a void. My inbox is filled with messages of gratitude from parents who have learned from my content. Women want to breastfeed for a myriad of reasons. Most are not choosing breastfeeding because of pressuring by lactation consultants as implied in the article. It is a biologic norm to feed our infants at the breast, and it should be a social norm, but we are far from that. The influence of the marketing of breast milk substitutes, which is a World Health Organization term, not my own, is too great and is reliant on the so-called mommy wars perpetuated in said article and in the comments that followed. But I digress. Breastfeeding is not just about nutrition and nurturing. Feeding comfortably and efficiently at the breast is imperative for optimum development of the muscles and bony structures of the head, face, and neck. But let's get back to my profession, in this case, lactation consultant. An international board certified lactation consultant is the title that is the highest in the lactation field. The education, training, and experience needed to obtain and maintain this designation is complex, long, and difficult. We learn more than any healthcare provider about how lactation works, how to manage it, troubleshoot problems, counsel parents, etc. Yes, I claim to know more about infant feeding than your doctor because I know that as a healthcare provider, I learned very little in my formal education on these topics. As a nurse, I was taught about breastfeeding by formula company representatives who brought us cookies or donuts to keep our attention. I challenge any MD to take a practice test for the IBCLC certification exam. I doubt they'd pass. Trust me, we learn more than, quote unquote, suggesting ways to position the baby that will decrease a mother's pain, as stated in the article. Of course, as in all professions, some of us are better at our jobs than others. Some of us bring other education, licenses, experiences, and certifications to the table. There are people who are expert at being doctors and some who are less so. Same with lactation consultants. Of course, lactation consultants make money, some more than others. Some through medical insurance, some outside of it. We provide an important service to those who need us and seek us out. Our value is rewarded as it should be. There is a problem when a reputable and popular journal makes comments that may be considered slanderous, such as insinuating that we are recommending unnecessary procedures to make money. I am insulted by this, as it is against all the standards that I hold for my practice. And I don't know anyone who gets kickbacks for this procedure. But let me explain what has me most upset about the slant of this article. There are almost no references to the thousands of mother-infant dyads who have had successful outcomes with proper tongue-tie assessment and treatment without complications. Of course, there are sometimes poor outcomes. That's the case for all medical and dental procedures. But I have had parents in my office who cry with happiness at finally having someone talk to them honestly, understand their concerns, and make sense of the symptoms they are experiencing. They express elation when they are on their way to meeting their breastfeeding goals, when their infant latches to the breast or comfortably and transfers enough milk to not have to supplement or pump. In my programs for professionals and parents, I educate the risks, benefits, and options for tongue-tie treatment. Treatment is not always surgical procedure. We make an assessment, give information, answer questions, and never promise an outcome. The assessment for tongue-tie is based on function. This is not a diagnosis that should ever be made by a picture or through a social media post. As a lactation consultant, the function is feeding comfortably and efficiently, meaning able to transfer milk in a reasonable amount of time. We should never recommend a procedure on a baby whose function is currently perfect to prevent future issues. There isn't a way to know how that baby will do. Anticipatory guidance is given for warning signs to look out for when frenum appears tied, but there are no current problems with feeding. For bottle feeding or older feeding, the function is speech and feeding. A speech-language pathologist who is a feeding therapist, preferably with oral motor training, is the best professional to evaluate the function at this stage. Meeting breastfeeding goals is a journey. Many times there are interventions by lactation consultants or other medical professionals that improve feeding or get the family set up for optimal results. A quick snip or laser treatment is not usually the answer, and preparation and follow-up will improve outcomes. I am truly sorry for the infants and families in the article who had poor results. I'd love to hear their full stories so that we can all learn from the process. Did they have proper functional assessment? Were they fully prepared, evaluated for other reasons that feeding wasn't working, given analgesia post-op, etc.? Finally, a message for parents who are pregnant and are planning to breastfeed. Do your research. before the baby comes. Meet with a lactation consultant, establish a relationship, learn how milk is made, how to optimize the first days, and when to reach out for assistance. Mostly, follow your instincts. Only you can know what's best for you and your baby. Okay, that was longer-winded than I expected. Let me see if Dr. Siegel is around.
I'm in the car, so bear with me here. I'm pulled over
Yeah,
for a bit.
that's fine. I know you're very busy, and we are so appreciative of you being here. Thank you. So, Dr.
Yes,
Siegel, there may be people watching us who don't know who you are. So, if you
right.
want to give a very short explanation or introduction, and
Sure. So
that's how we
for
can
those
start
of you,
together.
many know, many who don't know, my name's Scott Siegel. My background is, professionally, I am what we call an oral and maxillofacial surgeon. So I have both a dental and a medical degree, and I went to dental and medical school, trained in general surgery, and actually specialize in what we call oral and maxillofacial surgery, which is surgery of the jaws, face, reconstructive head and neck surgery. And my journey on, dealing with tongue ties and tethered oral tissue started about 23, 24 years ago with one of the pioneers in the field. Her name was Carrillos, who was kind of loosely quoted as an author in that article in
Mhm.
2004. But I started back then with her. She was a pediatric surgeon, chief of pediatric surgery at one of the hospitals I trained at. And her and Catherine Watson Jenna, who was also quoted in the article, I kind of learned from them 20 plus years ago about tongue ties, how they affect feeding, breastfeeding. There was not much talking about speech and other issues at that point. But my journey started at that point. My kids have had tongue ties. My wife breastfed. We all had to deal with these issues personally. At the time of when I was learning, I was using lasers, specifically carbon dioxide CO2 lasers for other oral surgery procedures and facial cosmetic procedures. And when Betty was actually mentoring me, she was asking me to do laser work on some of these kids with ties, especially what we're calling the posterior ones. And that started my journey. At the time, she introduced me to Dr. Kotlow and other pioneers. And that was, kind of when this all was really, really getting ramped up, although it's not a new procedure. An awareness kind of started coming around.
When I began to work in this field, I quickly realized that school didn't teach me enough about tongue tie. I wanted the opportunity to learn firsthand from an experienced professional. I had so many questions. Can you relate? Good news. I've created the Professional's Guide to Tongue Tie in the Breastfeeding Infant just for you. You'll get 4 recorded video modules, downloads to share with your patients, admission to a thriving multidisciplinary community for networking, sharing, and continued learning, and 4 LSERPs. All the details are on the website at tonguetieexperts.net/pro course. Use code podcast15 to save 15% off this and all of my courses. Can't wait to see you in the group.
And it started my journey at that point, dealing with lactation consultants like yourself, putting on conferences, going to multidisciplinary conferences that were being put on around the world for all of us to kind of come together and learn from each other, because we all were seeing things, but we were practicing in isolation. And we started having some international groups, what we call the IATP, International Affiliation of Tongue Tie Professionals. And then we kind of spun off from that and formed ICAP, which is International Consortium of Ankylofrenula Professionals. And I was kind of in both of those in organizations at the ground level, and really have been kind of vested in this journey, doing research, and trying to understand what best practices are and where we fit within the team. And what happened, with this, we can go down your bullet points here, but
Yeah.
that kind of led, I guess, these journalists to me, because a lot of people kept saying my name, across the country as somebody to talk to.
Mm-hmm.
And
And let me just interrupt. You were invited. They asked to come talk to you, and you invited them into your office, and they spent
yeah,
time
so
with you. And
right,
tell us a
so
little bit about that, because when I heard that, you don't know that from the article. It sounds
no,
like people were sneaking and giving bad reports about you, but
correct.
you were totally upfront with them,
Fully
transparent.
transparent. We had a Zoom meeting with the three authors. I had a Zoom meeting for about an hour discussing kind of my history, where I was, where I am, what we want to see moving forward, the concerns that we all have, potentially of overtreatment or not understanding when not to cut, things like that, and coming up with parameters to help guide us and working as teams.
Mm-hmm.
And I said, well, we're talking about all this, but why don't you come into my office and see firsthand?
Mm-hmm.
Because the way this was all portrayed to me was that they weren't doing a piece that was going to be objective and fair and balanced to try to understand what is going on. There seems to be an uptick in these procedures being done. We're trying to get a handle on it. And, your name kept coming up. They interviewed Kathy Jenna, who, was instrumental in that 2004 piece that talked about posterior tongue ties that was published in the American Journal of Pediatrics, Journal of Pediatrics, the AAP. And then I've done research with Kathy. So after they spoke to her, she directed them directly to me again. And that opened the door. So in a matter of said, listen, we'll have families that you can speak to. You'll be there. You get to witness how we do a consultation. You can speak to the families without me present. There's nothing to hide. We're not hiding anything. And see from start to finish in the office anyway how it works. So they were able to witness the intake. We talk about how it comes on the phone, how they come into the office. They listen why the families are there, who sent them, which lactation consultants or feeding therapists were sending, because they were just interested in babies at this point, not older kids or adults that we also treat. And they were actually able to witness everything from start to finish.
Right. And they came away acting like
they were very, they in between they were saying they weren't sure. Back together, and then what happened was a few days before a deadline. I think it was last Monday. They emailed me and said, they interviewed a person that had a negative experience, and laid out the name and whatnot. And I said, well, I'd love to comment, but I don't have permission from the patient, and I can't violate HIPAA.
Right.
So I said, I don't know, let me look up the details and give me the name. And if they eventually the next day they got a HIPAA release. So I looked and saw what happened. Patient was seen by a lactation consultant, sent to me. They did body work beforehand, seemed to have releases, that were uneventful, and struggled afterwards. And this was actually February of 2020. Right when the pandemic was starting. And when they started having real issues of maybe not progressing where we thought they should be within that time, we were basically within the early phases of the shutdown.
So there was nothing you could do with them.
Yeah, we couldn't see. They didn't want to come in physically to be seen. They couldn't see, aftercare physically. And there were some confounding factors that way that were not, elucidated within the article.
Right. And the other thing was, so they had one negative person from your practice. And I mean, they said how many thousands of babies you take care of.
Right.
And nobody's talking about the good outcomes.
And that's the whole thing. And when I explained, I said, we're certainly in medicine and surgery, you're going to have an outlier that we're trying to, maybe not responding the way you want it to or hope or think it may. And we're trying to understand, why these behave that way. And, we're always about, first of all, do no harm. and trying to
Right.
understand risk versus benefit. And again,
Right.
with all of these things, when we look at risk benefit ratios, yeah, the procedure does, carry low risk. And then there's no such thing as no risk in
Right.
surgery.
Right.
So they were able to hear that come out of my mouth speaking to families. And they
Right.
said, well, how come you don't talk about, major oral aversions and whatnot in your consent? I said, in my verbal consent, that's not something we just automatically talk about unless there's some sort of red flag. We do
Mm-hmm.
talk about difficulties with feeding, but we don't say oral aversion as a general thing, with our consents, and maybe you should
Right.
add that,
Right.
or whatnot. But it's not something that we see on a routine daily basis. And
Right.
I think that's one of the things that,
Right.
they were
And
kind of
and
baiting me a little bit. And
yeah,
at that
one of
point, I started to get the sense where they were headed. And
yeah,
it was very
I
scary.
want to say something about oral aversions because first of all, we've been practicing for years and evolving our practice based on what we're learning clinically and based on research. Even though the research, depending on how you look at it, is there a research base or not? It's a growing research base, but we must use clinical experience as evidence because that's how medicine evolves. We don't have the research. We can't have research before we're practicing because then what would we be keeping track of? Correct. So
Correct.
so we learn by our clinical practices and we've evolved our clinical practices. And from in the beginning, when I was first involved in assessing tongue tie and referring for treatment, there were some babies that did have some mild oral aversion. I never had a baby that wound up not being able to feed at all, but I used to have every once in a while a kid that had a couple of rough days. I haven't had that in years because of how we know now to properly prepare the family. I mean, this is what I preach in my courses to parents and professionals, and anybody who wants to listen to my podcast will hear me say this over and over. This is not a quick fix. Nobody claims it to be a quick fix. If we prepare the family, if we prepared with what we're going to do afterwards, if the baby is already feeding, if we have alternative feeding methods just in case, if we're ready with analgesia, the chance of oral aversion when done properly is almost zero, right? And I stand behind that because that's what I see in my practice. So if yes, I feel terrible about these kids who had bad outcomes. But let's not scare parents who want to look for help and don't know where to turn. And now they think by reading this article that we're just out to make money and we're cutting babies' tongues, which is the most ridiculous thing I've ever heard because you don't cut a baby's tongue. You're cutting the frenum, which is another story. I'm getting a little heated. I'm getting a little excited about this. But one of the things that upset me was I keep going to the comments, which maybe I shouldn't. And there are people who have had great results who are second guessing what they did to their babies instead of the reverse of thinking what they did for their babies. So that's what I want. I mainly want to empower parents to realize that not to look at an article that's obviously clickbait, one-sided, whatever, BS, literally, to get people to scare people. I mean, let's not scare mothers any more than they're already scared, right?
Exactly.
And breastfeeding is hard enough. I don't know if you read any of the comments, Dr. Siegel. Did you?
I started to, and then I got,
Yeah,
actually,
yeah,
honestly, just a lot of anxiety
yeah.
and had
Same.
to turn it off.
Yeah,
So
but
this
what
is
was
not positive.
upsetting was how fast breastfeeding was dismissed as something that wasn't important.
100%.
And
When I saw
you know,
that, and actually
yeah,
coming from actually physicians and whatnot that I saw,
yeah,
I was like appalled. I
yeah.
said, well, they're just clearly not understanding. These are people that will never understand it, and you're not going to
Mm-hmm,
get through to them to begin with.
mm-hmm,
So
mm-hmm.
it's you have to look at this and turn it into a positive and try
Yeah,
to use the platform to educate
yeah,
and still realize that you're going to have a subset of people who are just not going to trust or believe no matter what we
Right.
do.
Right. Somebody asked, how did they present the purpose of the article to you? I'm so upset for you. That's Playful Heart Pediatric OT wants to know.
Yeah. I mean, it's basically, I think I said as earlier, they portrayed this as going to be just an objective, balanced piece on tongue ties, understanding what's going on, how do we diagnose, how do we treat, research, parameters of care, and trying to understand what's going on nationwide or worldwide with this.
Mm-hmm.
And that's how it was portrayed to me.
Right. Other comments are a couple of people are saying that they don't see oral aversions, and somebody said, "What about the oral aversions caused by actions in the hospital at birth, the suctioning, etc." Which, yeah, I mean, from my years in the hospital, I know that. Um, Other people talking about the assessment has to be done correctly. We're getting lots of thank yous. Lots of comments about how incredible you are, Dr. Siegel, and how much people love sending their patients to you. Milk Matters, Dr. G says, we stand by Dr. Siegel through and through. And yeah, about how function is what we should be talking about, and none of that was
right.
None of that was addressed. And Lo Nigrish from the podcast says, I would love to hear how the author recommends we help babies with less than ideal oral motor function. Me too. I'd love to talk to the author.
It was just, I don't even know what to say, because it
Yeah.
was, when every one of those aspects that you bring up was discussed in
Right.
detail, not only by me, but I know they spoke to Dr. Zaghi for about an hour and a half,
Mm-hmm.
and we all pointed them to research and experience and where things are going on. They included nothing, as you can read, and they twisted things around, and it just sensationalized it. And I did have a family in just right before leaving the office who I've treated before, and the dad was like, I don't want to seem insulting, but I wanted to ask you about that article that came out yesterday. Say, listen, ask away,
Right.
let me tell you where that's coming from and what happened, and just be very upfront and honest, because people are going to ask those questions.
Right.
And there's nothing to hide, but we're here to educate and help. And
Right.
certainly after I saw that yesterday, yeah, my heart dropped, my stomach dropped,
Yeah.
and I was feeling very, I don't know, just ready to, in
Yeah.
tears.
Yeah, I don't blame you. I mean, my heart broke for you. I've been in that position a little less dramatically. Quite a few years ago, I was interviewed for a New York Post article, and by a friend of mine who also wrote for the Post, and she was a La Leche leader, and we were talking about the Baby Friendly Hospital Initiative, and she took one of my quotes out of context and made me. I got national attention for saying that we were going to lock up the formula, and that was like one little thing that I said, and it was totally blown up, and I just felt so violated, so I totally understand that feeling, and it was like PTSD for me, and knowing you and having you as a colleague and a friend, that's the purpose of why I said let me reach out and see what I can do. For full disclosure, I have reached out to Melanie Henstrom, who is the IBCLC in the article. Melanie is crafting a way to respond. I don't want to say too much about that, but I just want everybody to know that, of course, I'm reaching out to the fellow IBCLC because my heart breaks for her as well.
I reached out to her as well.
Yeah.
Because the whole aspect of how they portrayed the IBCLC, profession and therapy profession is just abominable. And it just the rage that we feel when we see that is just it leaves you speechless.
Yeah.
And you want to be able to try to get ahead of that and try to continue to educate.
Yeah, and after the initial, anger some of us had a lot of good, we were trying to make light of it. People are posting and sharing messages back and forth about, we want to know when we get in the kickback checks,
Yeah, right,
like,
right,
like, where are they? That would be fun. It's,
right.
all the money we're making from this.
And it's funny
It's
because I
ridiculous.
said, when they interviewed me, I said, there are people out there saying that, there's kickbacks going on and all of these things. That's just not true, but that's what they
Hmm.
put in there.
Right.
I said,
So sad.
it's not only unethical, but we can lose our licenses and all of the hard work that we do is
Right.
flushed down the toilet. I said,
Right.
maybe there are people doing that, but not anybody that I know of specifically,
Right. Right.
in our realm.
And yeah, and some of the comments, there's so many comments, I can't read them all. Thank you everybody for being here and commenting, but so many people are just saying that they hope that you feel the love, and they're thanking us for doing this, and realize how much
Well,
respect everybody has for you.
that's between, I think, Melanie had an outpouring of support. I mean, the outpouring of support that I had from the get-go worldwide from colleagues
Mm-hmm.
and patients and families, and
Mm-hmm.
families sending me videos of how I
Wow.
helped change their lives, and they're so disgusted to see that, and many of them are planning to write their own op-eds to
Excellent.
to
Excellent.
that,
That's
so
what we need. I hope they'll print all of
right.
our letters.
Likelihood is not, because I
Yeah.
know even with the comments yesterday, there were people reaching out to me. It's like I'm trying to comment something positive, but they're not letting me, and it's not
Wow.
going through. And then
Wow.
say the comment is under review, and it wasn't
And
going through.
the hard thing is that you have to subscribe even to challenge
Yeah,
the article. So
exactly.
they're going to make money from this. From
Right.
us being upset, they're making money. That's how media works right now. That's crazy.
It really is.
Crazy.
It's
Um,
sickening.
yeah. So, you know, just getting back to the anger about the bottles, just bottle feeding does not honor moms, right? And they're claiming to be like, let's protect the mothers, and it shouldn't be, the mothers shouldn't be doing this to hurt their babies so that they're comfortable. Like, what? Like, where do they even get this from? So it's just really, really upsetting.
Again, it's about education, and it's and again, not everybody can breastfeed, but
Right.
they still can struggle with bottle feeding.
Exactly. There
It
was
affects all
nothing about
forms of
bottle
feeding.
feeding this article.
No.
Right? And those who follow me know I often talk about my grandson and how he could not take a bottle, and he struggled to breastfeed, but my daughter, and she doesn't mind me saying this, my daughter had a very copious supply, so he was able to nurse, but he wasn't able to, he had barely any suction. His tongue just didn't work right, and his palate was awful. So in the beginning, he could not even suck on my finger. He could not suck on a pacifier. He could not suck on a bottle. If my daughter didn't breastfeed, he would have been a tube baby, right? So we did the process. Yes, he had release, but we did the process, and he's good, right? He's good, and he learned to suck, and he learned to take a bottle, and he learned to do all the things he needs to do. Mention bottle feeding when you're talking about tongue tie, New York Times, because there are many, and we have our friend and colleague Nancy Calamusa, right, who is doing work with babies who never had treatment, right, and are disabled, and tube children, and she's getting them released and getting them therapy, and now she goes all over the globe. Right now she's in London, right,
Mm-hmm.
treating babies.
Yep.
And if those kids were released as babies, they wouldn't have this hard journey, and on and on and on and on. So no, we don't think that every baby should be released. I mean, most of what I teach the opposite of what you would think. And I always say this, like, yes, it's called tongue tie experts, but the reason I'm teaching is to make sure that everyone understands that it shouldn't be a quick diagnosis. It shouldn't be a picture diagnosis. It should be a complete functional assessment. And I have recently podcast episodes that I was like, wow, this week's podcast episode is 5 ways that tongue tie treatment can go wrong. 5 points to consider about tongue tie release before you have it. research. I have a whole episode with Kathy Watson Jenner discussing the research that she's done in your office. And phrenology with the least trauma for parents. Like, we have an answer to every point that they made, and nobody's going to see it from there. And it's so annoying. I mean, anybody who hasn't listened to my podcast, if you need some reassurance, if you're a new provider, the Tongue Tie Express podcast is on it's on Apple, it's on Google, it's on Spotify, talking about the team approach, because this isn't just about, Dr. Siegel, I've heard you say this many times. What you do is the easy part, right?
Yeah.
You're doing the easy part. It takes what? They're in your office for an hour.
Right.
We're working with them for weeks, sometimes months.
100%. Yep.
But no, all we do is make sure that we just bully women. We bully everybody into breastfeeding.
Well, it's the other thing that needed clarification from that article is they kind of portrayed one of the cases as being done just for prevention.
Right.
And that's certainly not the case.
Right.
If a child is coming in with symptoms and a functional issue going on, we always talk about risk benefit, treatment versus non-treatment, long-term potentials, not saying that every child that has a tie is going to develop these issues.
Right.
But when you sit and listen to a consult, we talk about those potential long-term things. And if your child is already having some sort of functional problem now, odds are stacked against them that they may have some sort of other functional issue moving forward.
Right.
And there's research to validate some of those things, including the sleep apnea issues. The research that came out of Stanford with Dr. Guilleminault, and there's some groundbreaking landmark papers looking at short lingual frenulums and tongue posture and tongue position and how it affects oral, facial, and airway growth and development. And we discuss those.
Right.
So those are things, but, again, when you're talking about a sensationalist sort of piece, it's going to leave everything out that we educated them on.
Right. Because they had their agenda, and no matter what you do. And let's talk. I mean, this was about babies, and I work mainly with babies, but the both of us are involved in a project, the Airway Revolution Foundation, which everybody should check out, the Airway Revolution Foundation, which we're both on the board with that project and involved very much with that project, which it's not just about tongue tie, but tongue tie is involved, So to me, the insult is reverberating, across all of the work we do, and all of the professionals, all of the high level doctors, surgeons, orthodontists, body workers, for lack of a better term, and lactation professionals, SLPs, all myofunctional therapists. We're all trying the best we can. Of course we want to make money. I mean, who could live without making money, right?
But that's the other. It's not, you're not doing this to be money hungry or whatnot.
No.
And like when they asked about fees and this and that and how many babies you treat, it's like, it was very open and honest with them. It's like, but, and I said, I have 2 offices and a pretty large staff. Mm-hmm. So, what you think maybe my income is not, and it's not even, you shouldn't even be thinking like that. But that was the tilt of the article.
Right. Yeah, and I almost, my response is thinking about, you could plug in any type of doctor that is specialized in a field with the, what was the term used? I don't know if it was in the article or in one of the comments about like the factory model, right? So like, for example, I had to have a thyroid biopsy one day, and, a few years ago, and the ENT that I went to, I felt like I was part of a factory. It was like, you do this, you do that, you're waiting online, you go in, you come out. It was like, do they get in trouble? Are they making money? Are we saying, well, they should make money, but we shouldn't make money? You shouldn't be compensated for the work you do. It's crazy. It's absolutely crazy.
One of the things they also alluded to is like, it's a 5-minute thing, and then that's it. It's not, well, they actually spent, multiple hours in my office with each
Right.
family,
Right.
either bottle or breastfeeding. And one of my staff, Marielle, who's been with me for a very long time, went through the CLC and then became an IBCLC so she can help families feed right
Hmm.
afterwards,
And she's
bottle and
amazing.
breast.
She's so patient.
And so they're able to witness that and how long they're in my office for.
Hmm.
So it's not like, may have the feeling of an efficiency, going
Right.
on because we're efficient. We have an efficient model
Right.
of, practice and business, but it's not a factory.
No, as it should be efficient and
Right.
smooth and comfortable. And,
And
full disclosure, obviously I refer a lot of patients to you, but I also now, because there's more people learning, I have a list of doctors that I refer to, list of dentists. And after every family comes back, I always ask, what was your experience? Would you recommend that office to someone else? And no one has ever said anything but, oh, Dr. Siegel was amazing. We felt so comfortable there. These are the responses that I get. They made it easy, they made it comfortable, they made us relaxed. Yes, it was hard to do the procedure because, it was hard, but they made it as easy as possible. So I don't know. And I'm sure being in your office, they experienced that as well, which is crazy.
listen, they did, and they were
Yeah.
very, they seemed excited about it. And so,
Hmm.
and that's where I, was lulled again in being naive.
Right.
Unfortunately, that's, you learn
You're a
these
victim of being
lessons.
too nice.
Yeah, and again, it's like you're not going to make everybody happy, and every outcome is not going to be what you're expecting. But if you do your best with the best intentions, and first of all, do no harm, and try to understand when not to be cutting, and make
Right.
sure you have a team in place. And I'm
Right.
not that leader of the team, where you are, or my therapy compadres and colleagues are the
Hmm.
quarterbacks. And
Hmm.
it's really trying to drive that home so they understood that didn't work.
Right.
And what they did to the poor Melanie, and outright slanderous
Yeah.
things are just,
Horrible.
it
Horrible.
is.
So,
So
Dr.
there's
Vitrick, Dr.
that.
Vitrick is here saying thank you, Dr. Siegel, for all you do saving lives. Lifelinks Lactation wants to know if the New York Times ever wrote an article about reflux medicine being overprescribed. That's a good point. Everybody's saying how much they love Mariel. You can tell her that if she's not listening. Patricia Berg was told years ago that she shouldn't get paid as an IBCLC.
Yeah.
Oh my goodness. Oh my goodness.
And the question comes up is, well, how come you're not taking insurances? You should be taking insurances.
Right.
It's like, well, I wouldn't be able to keep my business open
Right.
just focusing on this if I did that,
Right.
unfortunately.
Right.
And I said, well, maybe you should, write to other people about fixing our healthcare system because of that.
Right. Right.
I'm trying
Mrs.
to,
Foley said, I was gaslighted by 3 providers before seeing Dr. Siegel. Thank you for making me feel like I wasn't an insane mother. And Lifelinks Lactation, she's actually Sarah. She was interviewed on my podcast. If anybody wants to hear a heartbreaking story with a happy ending, that Sarah's story is on my podcast. Thank you for being here, Sarah. And she shared her whole journey with me. She knew something was wrong, and she was ignored and gaslit, and nobody was listening to her, and her baby was failure to thrive, and it turned out it was a tongue tie, and once she got somebody to release it, things got better. Yeah. So, and Melanie is here, so
and
grateful for you both. Yes, Melanie, we are with you. You know that. We are with you.
100%.
Oh,
I'll
yeah.
speak to her later. The
Yeah.
One of the issues that came up in we had a professional meeting last night, and one of
Yeah.
the docs, who's a very well-known sleep airway doc, who really said, brought it to light. It's like, we don't want to dismiss the people's voices that
Right.
are having problems, and the ones that were highlighted in this yesterday's article, those are important voices to hear. But there are other voices as well, and it's our chance to try to educate here, and use the negative that has come out and try to spin this into a positive platform.
Mm-hmm.
And but hopefully bring it to the attention of the New York Times. Our dear friend and colleague Robin Walsh, I don't know how she does this. I
Right.
think Rich Baxter said she's like better than Chat GPT. She just came up with this
Yeah.
amazing letter to the editor, which
Yeah.
was so eloquently worded, concise and clear, and
Mm-hmm.
hit every point, that I'm hoping that it is published, because it can bring to the light of the authors that they did wrong.
Yes, yeah. And
They did.
yes, let's talk a little bit about, because I was also had a couple of people say to me, well, Lisa, no, not everybody does things the way you do. There are people who aren't doing this the right way. And
Yep.
that's absolutely true. And that's why we teach, right? That's why we come on platforms. That's why we have conferences. That's why we both speak at conferences. Why you do so much supportive education work. You've put on your own conferences to get people to realize that this is something that can be done wrong and for the wrong reasons and without the right support. And it's
Right.
very important. Like, I had somebody last week ask me if I think this is overdiagnosed or underdiagnosed, and my answer is both. I think it's missed, but then it's the quick diagnosis sometimes that it shouldn't be without a functional assessment. So it's both.
Right.
We have so much work to do, so
Right.
much work to do. But we will do it because the families need us to.
Yeah, and that's what I also said to them, and I put it in writing. I said, this is we're in a specialty right now that's evolving,
Right.
and we're learning, daily. There's, research coming out almost daily or weekly. There's conferences that are held, and when they asked me about this case that I treated 3 years ago, I said, it's I don't know, it could be treated differently at this point. And they kind of put it in there as quotes too,
Yeah. Yeah.
to try to steer it in the direction that they were looking for.
Right. Which wasn't fair. Wasn't fair.
No.
Even I could even tell, I mean, I'm just guessing, but I've heard Kathy Jenna speak enough to know that her quote wasn't, they didn't include the whole paragraph
Right.
of what she usually
The
says
context.
about what she was saying. I'm like,
Exactly.
no, she usually says that, and then she says this, and they
Right.
cut off the this, and they just said that,
Yeah.
so.
So
Uh,
the cherry picking aspect was pretty obvious.
yeah.
And for
Yeah.
people that are gonna, understand how to, look at an article and say, well, yeah, it's a biased hit piece, but other people will take it, seriously.
Yeah, especially, I mean, people are looking for something to fulfill their agenda,
Yeah.
so, oh, look, they were right. There's so many people thanking them for pulling this
Yes. Yeah.
out, for putting this
Yeah.
out there and saying the things that they've been
Yeah.
thinking.
It validated their, their
Yeah,
feelings and their
yeah,
beliefs.
their
And
agenda.
again, it's
But,
like, Rajiv Agarwal, who's a very well-known pediatrician who treats these, and says this is not a
mhm.
religion, it's not a belief system.
Right, right,
It's anatomy and function, and
right.
it's something that we need to educate on. We
Hmm.
understand where pediatricians are coming from. We understand where families that are fearful or vulnerable are coming from, and we do want to make sure they're not feeling taken advantage of. And that was a goal of trying to disseminate education with this article, which I was, naive in thinking that was
Yeah,
going to be something that would help. But
yeah. Well,
again,
in the end, it will.
right,
And it will help, because look at the conversations that are happening today. I mean, I think I was, when I say how angry I was, my family was worried about me yesterday. I was really angry, and then I said, let me just step back and see what we can do to turn this into a positive, and to have more exposure about the way that things are actually being done, and the way that people can learn more, and how we can do that. So, Dr. Siegel, thank you so much for joining us today.
it's
I totally appreciate it. And
You're an amazing
thank you for.
force in the field here.
Oh,
It's
thank you.
like,
Doing my best. And thank you to everyone who has
yeah.
joined tonight, who is listening to this recorded. If you're listening recorded and you want to, reach out with questions, we're here. And thank you for sharing it. Thank you for sharing. So many people heard about that we'd be doing this tonight because of so many kind people who shared it all over social. So thank you. Everybody have a great evening. Get home or wherever you're in the car to, get there safely and have a happy holiday.
Thank you, Lisa. Thank you,
Bye-bye.
everybody.
Bye-bye.
Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue Tie Experts Insiders. It includes monthly online meetups with me, Lisa Palladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue-tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.